Hey everyone, I'm here today with my friend Dr. Raj for the 5-minute care tip. Today, we're talking about mechanical ventilation. It's a term that I'm sure folks have heard here and there, but what is it, Dr. Raj?
Yeah, I already got a little tingle in my chest because, when I do ICU medicine, I don't think my job, let me take it back. I know my job isn't to put people on the ventilator. I really feel is to have that conversation to prevent them from getting on the ventilator. Don't get me wrong, there are some individuals you're fighting for a really bad pneumonia, and I'm getting flashbacks from during COVID times, they needed to be on that ventilator. But, sometimes you don't realize until you look at your loved one what it means to have a tube. But that's what mechanical ventilation is taking a tube, putting it through your vocal cords, and it goes into your lungs, and literally a machine is taking over your breathing. And when you are on a mechanical ventilator, just like it sounds, it's not pleasant. It's very claustrophobic to be there. So of course we have to sedate our patients. And most of the time we will sedate using two things. One would be a medication for pain, because many individuals after they leave the ICU, it's this IV and that stick and that poke. There's a lot of pain going on there. So we give pain meds. And of course we want them to sleep while they're on the ventilator. And God forbid, sometimes when they're having very bad lung disease and they're fighting the ventilator, not purposefully, we may even have to paralyze them. You know what I mean? So, I think when someone needs mechanical ventilation, it's in what context? I feel like in the acute setting, sometimes it just needs to be done. I think that as we get older, as you have comorbidities, someone with cancer, someone with dementia, really ask these questions is, what do you mean by putting my loved one on a mechanical ventilator? And it's good to be proactive about these things. But yes, that's one of the things that they do in the medical ICU is invasive mechanical ventilation.
So along with that, here's a question that I've heard come up, and I think there's misinformation about that. Sometimes you hear people say, well, if you're intubated, if you're on mechanical ventilation, you're never coming off. Is that the case?
Well, the first thing in my mind once I put someone on the ventilator is how soon can I take them off? You know what I mean? And every day we do what's called a weaning trial, a spontaneous breathing trial to see if they can get off there. Because if you're on the ventilator too much, you're going to develop a pneumonia. Your secretions will be very thickened. Especially because you're going to be sedated over there. Your whole body gets weak. You know what I mean? And they call that critical illness myopathy, where your muscles get weak, hence the word myopathy. So we want to take them off. So I think what you can do as a loved one, as someone who is an advocate, the minute someone is on the ventilator, ask your doctor, your intensivist, what's the plan? What are we doing? Why are they still on the ventilator? And get a good feel about everything.
That's great. That's really helpful. Helps me, and I'm sure it helps the audience. So Dr. Raj, thanks for the tip for today, and we'll see you next time.
All right. Thank you.